everyone. It's Marta Cook, the founder of Brown Girl RDH, and I am here with Maria Watson and Sabrina Hamilton. We are following up with Sabrina, who tested positive about 2 months ago for COVID-19. So she's going to give us updates about where she is now, how she's feeling, and what to expect. We're going to touch on returning to work. Should we be concerned? Are we going to be forced to go to work? And what does this mean for the RDH? What does it mean for the dental professional? What does it mean for people with families? So hi, Sabrina. Hi, Maria.
Hi. How are you
Sabrina.
all?
Hi, guys.
Hello.
You look great.
Hi.
You sound even better.
You do, girl.
Yeah.
Yes. It's good to see your face this time around.
I went back to watch my video.
You weren't feeling up to it.
No,
Yeah.
you know. Yeah. I was sick.
Well, you look good.
I was sick. Yeah. Thank you.
And you know, if anybody didn't see the video before, Maria and I interviewed Sabrina a couple days after she found out she tested positive for COVID-19, and you know, it's very emotional. She gave it was firsthand account of what was going on with her, and during the interview, you know, it was the insight. This was before anybody was coming out. Like, we were the first ones to be like, this is a hygienist who tested positive for COVID-19, and nobody was really talking about it. And mind you, people were testing positive for COVID. They just were ashamed to tell it. So Sabrina was brave enough to share her story. She wasn't well enough to be on camera, but if you have a chance, go back on our YouTube channel, Brown Girl RDH TV, and listen to her story, and we'll see how far she's come. So tell us what's been going on since then.
Hi. Well, what's going on? Working on myself, getting my, I've been taking this time to fully recover from COVID. It took a long time, longer than the average virus. A month out. I tested on the 18th, got the results March 25th, and it was a month out. I was still not 100% back. I was up, moving around. I started feeling like, oh, you know, let me go for some walks. And it was upon going for walks that I realized that, you know, my oxygen levels and my lung capacity, there was a difference. Whereas I could walk in my neighborhood 45 minutes, no problem. Literally within 20-25 minutes, I was short of breath. So I could, even though I felt like I was okay, it was upon those walks that I realized that I was not 100% recovered. So what I did was I waited about another 7 to 10 days and just really worked on myself. Not as if I was sick as far as medicating, but I was doing things like eucalyptics and drinking teas and vitamin C shots and things like that, just to work on building my immune system a little more. And just really taking the time to just let my body recover. Because I had pneumonia as well, my understanding was that, you know, having them both, it took a good 6 weeks for me to feel like myself. And to this day, 2 months out, I still have my taste and ability to smell still comes and goes. It's not the way it was where I totally lose my taste and smell, but sometimes I wake up in the morning and I realize that I can't taste or smell, and then maybe in the afternoon or evening it's back, and then vice versa. So I still have that happening, which to me is like I've tested negative. I tested negative April 15th.
Oh, okay.
So I'm negative for COVID, but there's still these things like, you know, my ability to taste and smell has not returned to normal. So that's that, you know, and it's some other things that I think about. You know, I hear what lasting and long effects will COVID have, any if possible. So I'm concerned about that.
Sabrina, can you tell us what side effects you had, like during your illness from the beginning to the point that you tested negative? What side effects did you have? What symptoms did you have?
The symptoms that I had from the very beginning, coughing, fever, no taste or smell, body aches, and some labored breathing, but not to the degree that, we've seen other people. I didn't have to be hospitalized or on a ventilator, but off and on fever for several weeks. And I could go 2 days without a fever. And then just out of nowhere, I would run a low-grade fever 101. Just exhaustion. And then I could wake up one day and feel like, oh, okay, I feel pretty good. I'm going to get up and move around. And then the very next day, I'm back down. So they wanted to test me when I got retested, I had to be symptom-free for 3 days. So I still had a lingering cough, but my doctor, decided that it was okay to retest me. And thank God I tested negative. But I had a lingering cough. Even when I tested negative, I still had a lingering cough. Like I said, it took about 6 weeks.
So did the test change from when you first got it to when you went back to retest a month later? Was it the same test or was it different? I mean, how was that experience?
Awful. The first one, they went in with the swab in each nostril. Mm-hmm. And it's pretty much what I'm sure you all have seen on social media. It is awful. And the second, when I retested, at that point, they went into just the one nostril, but it was still very painful. It was very painful. Mm-hmm. Yeah. It's exactly, the what you see on social media, the testing that's done. It's painful. It is. And, and since then I've, tried to learn as much as I can. I mean, every day is something new. They still obviously don't know a lot about coronavirus. But I saw that, I made the decision that once I tested negative and I qualified to donate plasma, I did do that. One donation saves several lives, and it's saving people lives who are literally hours or days. They're on ventilators, they're in ICU, and the doctors are literally telling their families, we don't think that they're going to make it. And it's been 3 or 4 people that their stories, the plasma donation, literally within 24 hours, they totally changed and have recovered. So I can donate plasma, I think it's once a month. So I'm going to do that, a couple more times to try to help out. I mean, how could I not, so,
mm-hmm. That's
yeah.
Great.
Yeah, I didn't realize how important. One, I don't like needles. Like, I'm a scaredy cat. You come to me with a sewing needle, you trying to sew my, like, wait, okay,
right.
I don't care what kind of needle it is. But that is actually, if you can donate plasma at your local Red Cross or plasma bank, I would definitely recommend it. So I know I have friends that do it all the time, but me, I wish I was brave enough. So what was the difference? Did they say anything? Did they have a lot of people that were exposed to COVID coming in donating to help, or what?
And back to the needle, I'll be honest with you. When I said, is the needle different for plasma? Is it big? And he said yes. And I thought he was being sarcastic. And I said, no, seriously. I said, is the needle big? He said yes. I said, oh, I can't do this. I said, no. I said, because usually I was like, your response is supposed to be no. He's like, well, I don't want to lie to you. I'm like, I can't do it. I can't do it. I can't do it. But I thought about it. I said, Sabrina, come on. It's saving lives. But I'll be honest, and it didn't hurt. It really didn't hurt.
Oh,
but yeah, so it's funny that you mentioned the needle part of it. But he did, the fact that he mentioned that the blood of the COVID patients. So I'm assuming that there are people donating, not enough, but there are people donating. And what I have been doing is people that I know who have recovered from COVID, I have been asking them. Somebody today, a friend of mine, he and his wife both have recovered from COVID. And I talked to him today. I said, 45 minutes of your time, just one donation can save several lives. So he told me, he said, I think he's saying that he may do it. But the nurse did mention that he had patients, COVID patients donating, and he was noticing the difference in the color of the blood of the patients that's donating COVID plasma as opposed to the regular donations. That was a little scary for me because he showed me, because I said, what do you mean? What do you, and he said, let me show you the comparison. And he showed me mine with someone else's, and I could see the difference. So again, I'm just thinking back to the blood work that I had done, and all my levels were off. That's another thing that I think I want to do at this point. I probably should have another CBC done to see what my numbers are now as a comparison to 2 months ago. That's probably something that I should do now.
Definitely. So you've been out of work all this time?
Yes.
Since early March, right?
Since early March, yep. As soon as my
Yeah.
symptoms started, I stopped working.
Yeah. So how have you been doing, just being at home, and are you keeping yourself busy now that you're feeling better, or you still just kind of taking it easy?
Yeah, I'm taking it easy. I'm moving around. I walk every day for 45 minutes. I'm still drinking tea and eating healthy, and my eucalyptics, things like that. I'm trying to, because there is a part of me that's still just the unknown. So I'm still very careful, and I'm just home relaxing. And I'll be honest with you all, emotionally, about 2 or 3 weeks ago, coming out of this, I got real emotional. When I see the numbers coming across the screen, I just got really emotional about it. I'm like, wow, I'm 10 or 15 years from now, I'm like, I'm one of these numbers of these people that had this awful virus. I thank God that I survived, but yeah, it got really emotional for me about 2 or 3 weeks ago. My anxiety was really bad. And so I had to start taking something for anxiety because I was having a hard time sleeping. But it's a lot. I just didn't realize, like I said, until I came out of it. I was too sick to worry, to be honest with you. But once I came out of it and really started thinking about it, thinking about my profession, when will I be comfortable enough to go back? So I've had to take a break and limit myself to social media because that was contributing to my anxiety as well. Reading other hygienists and their apprehensions. So it was a lot. Yeah. So I've had to, take something as needed for my anxiety.
So yeah, like you said, the social media, and everybody is an expert, right?
Yes.
But it's like now you had the actual disease, COVID-19, you had the disease. But for the people who haven't had it, and then we start seeing people go back to work, we understand, like, okay, this is real. Like, we may not be protected. It's like, okay, one, this is the virus. It's out. This is not a COVID discussion. The virus is out. We know. Two, the virus is not under control, but we're back in there. Like people are being called into work. They don't know what to do. They're having dilemmas. Oh, if I don't go back to work, then I can't get enough unemployment. So we are actually being forced back into. Right. So we're being forced into situations where we don't feel comfortable, but we have to. Right. If we don't, then that's it. So somebody was telling me today, like, I'm going to go back to work, but I'm going to make sure they fire me so I can collect unemployment. And I started laughing. I'm like, are you seriously going to get fired? She's like, yes, I am going to get fired. Like, I'm going to go in there, like, tearing the walls down, because I don't want to work. I don't feel safe. And I'm like, that's actually a good idea. So if I get called back in acting the fool, I'm because of everybody. But that kind of relieved me. I was like, okay, there's a plan B. Like, because I'm always like, what's the plan? What is the plan? So let's go in there kicking over autoclaves.
Right.
They'll fire us. No, so we're in these dilemmas. Like, okay, what do we do? We're being forced to go back. If we don't go back, right now we have unemployment. Some people can kind of, it's a cushion right now.
Right.
What if you don't go back, then there's no unemployment. I had at least 3 people post in the group about that. Like, my employer is forcing me to come back. And then I just saw an article that I didn't even read it or anything, but I saw it was like the President Trump and someone else saying, like, if Americans don't go back to work and they're offered their position back, then they won't be eligible for unemployment. And I'm like, okay, when does that take effect? So now if that's the anxiety, like, okay, I have to go back to work and I don't feel safe. I'm going back to not my choice. I'm going back to work, even if they don't have the proper PPE for me. I still have to go.
Right.
What do I do? So I don't know, but I always think about, somebody asked me, do I wear a mask when I go out? And I said no, but if I walk past somebody in the store, I hold my breath. And they were dying laughing. I'm like, you don't? I'm like, yes, I do, because honestly, like, I feel like, okay, it's in the air, it's everywhere.
It is, right.
Getting a droplet on our lip and we licking our lips. Like, I don't know, but I don't know. It's very scary. I don't know. I'm not going to act like an expert. I do my research. I hear what people say, but yeah, unplugging from social media will help a lot of the fear.
Oh, yeah.
I
had to.
I had to myself. Same thing. Don't watch the news.
Right.
Do your research and read as much as you can.
Right. Yeah.
Research about the research.
So where you live, the masks aren't mandated when you're out in public?
No.
Oh, wow.
Are
okay.
They
no, they're not here.
Oh, wow. Okay. Here in Maryland, when we leave the house, we have to have a mask on. Oh, yeah. You can't go anywhere. You can't go anywhere without a mask here in Maryland. Yeah.
So they just want you to have your face covered because
they want your
shortage.
I'm sorry.
I was thinking, what about the shortage for the medical professionals?
Well, no, you don't have to have on surgical masks. You have to have face coverings.
Okay.
So, yeah, and I've actually been making some. We have to have face coverings. They don't have to be surgical, or they don't have to be N95 or level 3s. They just want your face covered, but we cannot go out in public here in the DMV area without a mask on or face covering.
Okay. So, but you guys are back to work. Like they issued, you guys can go back to work. And
for non-emergency procedures. So some offices are opening up. I know.
How does that make sense? Like, you have to have a mask before you come out.
You have to have a mask on and you have to social distance, but you can go get your teeth cleaned.
What?
Absolutely. Absolutely. And I kid you not, now you can go get your teeth cleaned, but if I walk into the Wawa or the Royal Farms without a mask on, or try to go in Walmart, the security is there to escort you out.
That makes 0 sense.
I kid you, yes.
Because you take your mask off to get your teeth clean.
Right. Yep. A friend of mine today.
10 inches away from the next person, not 6 feet.
Absolutely. And we're getting calls to come back to work. I mean, someone reached out to me today, doctor, and wanted to know would I be ready to come back June 1st. I said, no. And the numbers that are displayed on the TV, the numbers that we're getting in any state, those are numbers that are reported to the health department. What about there are people out here who are walking around, who are at home with COVID, who are asymptomatic. So whatever the numbers that you are seeing on the news and on the TV, though I don't want to say they're accurate because I can't, but you can do the math. The people that are walking around, the exposure is just, when I first got it, your chance of getting COVID probably was 1 in 1,000, who knows? But now, as the number, I keep telling everybody, as the numbers rise, so does your chances of getting COVID. And they're opening dental offices. And again, when I first got it, you know, I'm wiping down, I'm sanitizing. I was the type that kept Lysol in my car and took if the dental office didn't have it, I had Lysol in my car. I always sprayed my rooms down in between patients for, you know, airborne particles, and just, it's just been something that I've been doing since I've been a hygienist. And I got it. I got it. Now, you know, I can't even imagine right now today going back to work. You know, my anxiety level, everybody that walks in, and, you know, the patient comes in, do you have COVID? No. Are you sick? No, etc. But who have they been around? Who have they been around that has been exposed? And then the idea of taking temperatures. I'm not saying don't do it, because it's a step. But what I want people to know, the 3 visits that I went to the ER, the 3 visits, I did not have a fever. I would, you know, I would take pictures of the thermometer when I had a fever, but every time I went to the ER, I didn't have a fever. So someone walking into the dental office to get their teeth cleaned, you take their fever and they don't have one, and you think, oh, you're fine. I literally was walking around sick.
Yeah, so use that as a safety net. Like, oh, they don't have a fever, they're okay.
They don't have a fever, they're okay.
I have my mask on, I'm okay. Like, that, you're not. It has to be like, I don't know. I don't.
No, absolutely not. No. You know, so I've had some people say, oh, we're taking temperatures, we're doing this, we're doing that. I'll say, you know,
that's great, but it doesn't do anything for my anxiety. And as a patient, honestly, it's like when you go to, I'm not going to say you go to visit somebody in jail or prison, because y'all probably haven't done that. But they checking this, they checking that, they looking in your ears, they want to see what tooth you got missing. Like, you're going through a lot. So if you're coming in and they're to check your temperature and please wash your hands and use sanitizer, and do you have on socks, like, that's a whole lot. For me as a patient, I would just be like, okay. Like, I wouldn't even want to be in that appointment. So I'm shocked that patients are actually, I know oral health and, you know, people have to get their teeth cleaned and they need the maintenance appointments, but I'm just kind of shocked that people are going. Every time I talk to someone, I'm like, did people show up? And my best friend, he was like, yeah, I'm going to the dentist to see about my tooth. His tooth is super erupted. I'm like, that thing been super erupted for 10 years. Like, why are you picking right now to go to the dentist? Like, are they giving away candy in there? Trick or treat? Like, what is going on? He's
in the middle of a pandemic.
Like, no. Like, people are at home. They're not working. They're like, oh, why not go to the dentist, right? I have time now.
Right, yeah.
Now is not the time.
I know.
I mean, I'm just saying what my opinion, because some people will be like, some doctors may be like, you know, oral health care.
Oh, yeah.
And y'all Supermaning in the sky, but as soon as your hygienists get COVID.
Right.
Like,
right.
I'm not willing to, you know, be in the hospital over somebody's calculus.
Absolutely. Absolutely. There was an office that opened up here in Maryland recently, and the front desk staff has tested positive for COVID.
The front desk?
So my thought is now, do the front desk just quarantine for 14 days or the whole office? You know, because when one person gets it, technically everybody around them, the patients who were in the office that day, you got to call all of those patients to tell them to quarantine for 14 days. Everybody that you've come in contact with technically is supposed to quarantine for 14 days. So that's the way it's supposed to go.
They said they were doing shifts. So we had another discussion, and people said that they were doing shifts. So it would be a morning doctor and a hygienist, and they would work and then split the shift, and then an evening doctor and hygienist would come in. And if someone came in with COVID, then it would be like, okay, then that shift would quarantine. that was the solution, is what one girl was saying. Didn't she say that? And I was like, well,
Mm-hmm.
it's in the air. If it's in the,
But the shift is working in the same office, right?
it's the same office.
Mm-hmm.
So
Okay.
how is that
Makes
even?
sense.
If one shift gets
It's
it,
not a viable solution.
right? I mean, it might sound good, but I don't know. It was just weird because
No,
it's
that
So who's
doesn't
to
even
say
sound
that
good. That doesn't make sense.
you
it
clock
doesn't
out,
make any sense?
right? You clock out, touch the little buttons, open the door. Then your next shift person comes in, touch the locker, microwave.
Right.
You might be spreading it.
Right.
Mhm.
I didn't get
And
that.
who's to say that you won't get 2 positive COVID patients, one at 9 o'clock and one at 2 o'clock? Like,
Absolutely. Absolutely.
I don't know. I know, a lot of people feel like they had it and they just got over it. I mean, I was sick at one point, but it's like maybe we all have been. I know 3 people personally right now that were exposed to it, and I've been hanging around them after the fact. They were like, yep, I had it back in December, couldn't breathe. They told me I had pneumonia, like same story. And I'm like, oh my,
Right.
and that was in December. They're like, yep. They told me I had an upper respiratory infection. He said that was
Mm-hmm.
COVID-19. Nobody knew it was, the disease was out like that. I mean, so I don't know. I feel like it's like the chicken pox. It's like you gotta get
Right.
it. But we don't know after we get it. He said he built up antibodies to it though. Like, did they test you for your blood for antibodies? Or
No. The fact that I tested positive was I have the antibodies.
they
The
said,
antibody test is for the people like you said, you were sick in December. People that were sick in January got the upper respiratory infection diagnosis or the pneumonia. If you were never tested for COVID and you were sick in December, January, or even February for that matter, and and you were never tested for COVID, you can go get an antibodies test now to see if you had it, to see if you have COVID antibodies in your but no, they wouldn't, the fact that I tested positive for it, I have it.
yes. Okay, because that's
Yeah.
what he said. He said he thinks he had it in December and they wanted to test
Yeah.
for antibodies.
Well, don't quote.
so what?
I don't know about every state, but I do know that LabCorp for $10. I heard on the news, if you go into LabCorp for $10, they will give you an antibodies test. If you thought at some point that you possibly had it.
Oh,
Yeah.
I need to go there.
Right.
Yeah.
So it's been talk about having like the rapid tests readily available for dental practices to be able to test our patients before we treat them. Would that be something that would make you feel better about going back to work? Or would that still not, kind of calm your fears if you were able to test your patients before working on them?
Okay. I'm gonna say yes and no. Yes and no. I would feel probably more comfortable with that. And well, that in combination with taking the temperature I need a package deal. And I'm gonna say yes and no because if I go to the dentist today to have my teeth cleaned, if I went to the dentist today and I was maybe around some folks Sunday and Monday, if I go to the dentist today, I'm going to test negative for COVID. 7 days from now, when I start experiencing symptoms, I got to call my dentist back to say I have COVID and I was it. Same thing that happened to me when I got sick with my first symptoms March 5th. Everybody that I had come in contact with 14 days prior to that date, I had to think back and I had to call because, again, asymptomatic. I got this virus in my system, but I wasn't showing symptoms until March 5th. So again, I don't want to shut that down and say no, but what I'm saying is you test me today and I test negative, and then by Friday or Saturday, I started this cough. Whoever I've been around that week, I've potentially infected that person too. So yeah, I mean, it's an idea, but nothing is full, and I hate to make it seem like, I'm kind of shutting all these ideas down, but again, just from my personal experience, I just know that people are walking around asymptomatic. Yeah, no fevers. I have a friend that works for Comcast, and he said he had this dry cough for 3 days. Nothing else wrong with him, just a dry cough. And his wife suggested he get tested, and he said, I don't have COVID. He's like, no big deal. I don't have COVID. His wife kept saying, so finally he got tested. He called me, Sabrina. He's positive. His wife is positive, and the 2 teenage kids are positive. Just a cough. He's never had a fever. He's never had anything. He just had this dry cough. So, and then now we're in allergy season. So guess what? Somebody walk into your dental office with a cough, that's just where I'm at with it. I mean, right now with my anxiety.
That's craziness. I know.
Right.
So you feel better overall?
I do. I feel better overall. I really do. It took a long time, but I finally, because at first everybody's like, oh, you look great. I said, I'm not back 100% yet, but I can finally say I do. I feel 100% back to normal outside of that occasional losing my taste and smell here and there. If that's, and I don't know, that could be my norm. That's another thing. That could be my norm.
Your norm post-COVID, now that you had the actual disease, now it's just one of the side effects of it. Like, this is one of the side effects. If you had it, then
yeah. I don't know how long this is going to go.
We don't know because we don't know the history of it
yet.
Like
Absolutely.
You're going to how your blood's going to look. This is what your blood work is going to look like.
Right.
So like the TB skin test, like we had it, we'll test positive, we'll raise it, but we don't have it. We take our chest x-ray and everything's good. So this might be one of the things. So, and once they figure out how the disease works and we get more research on it, it's just so sad that it just happened like in November, and then in March, boom, COVID, and it's May and everyone's like, stop. Okay, now y'all can go back. And it's like, we still don't know. It's so scary. It's very scary. It's very, very.
It is.
And what's for, my question was, when a friend went back to work last week, the governor 2 weeks ago in Maryland, I said, what happened to, we're not going to go into phase 1 until there have been 14 straight days of declining numbers. We haven't seen that yet. How are they opening stores and barbershops and beauty supplies and dental offices and salons and this and that, nail salons? They said that. I didn't make that up. I'm like, didn't the president say give us a phase 1, phase 2, phase 3? And then the governor of Maryland 2 weeks ago, and I know, listen, some people are going to be upset because people here think highly of Governor Hogan, and so did I, but I'm thinking, what has happened that all of a sudden going into phase 1, the rules have changed? I don't get that. But I have just come to the conclusion that I said, listen, it is every man for themselves. You have to do what's best for you and your family and your household. So, and I know that the numbers that I see coming across this screen, I personally feel those numbers aren't accurate. And my chances, the chances of getting COVID every day, your chances rises of getting COVID every day. So, for myself, I'm not ready to go back to work. I'm not.
It's a wonder. Now that you say that, like, you're affected, obviously. Now you're affected long term. So this is something that's chronic because you still have symptoms. But is this going to be something that you have anxiety from this now?
Right.
You have post-traumatic stress. Like, this is an effect of a disease. So
yep.
It's a disability for you and for many people now. I know it's, you don't want to say disability, but it's a disability at the end of the day.
Right.
Altering the way you live your life from here on out. So we don't know how it's going to affect each and every person. Maybe I'll get it and be like, okay, I'm good. But then you get it and you're like, I just don't want to get out of bed. I feel like
I know.
I'm depressed about whatever.
Yeah.
I almost died. I could have died. Psychologically,
Right.
that is trauma.
Right.
Post-traumatic
Right.
stress, and you're
Right.
going through that, and then we have to go back to these patients, and we have to see these
Right.
patients. And every time a patient gets in my chair, and I'm putting on all this PPE,
Right.
I'm triggered, right? Like, okay,
Right.
I had it now. Like, I got to do whatever I can not to get it. And if you're constantly thinking about that, who wants to work?
Yes.
You're being forced to go to work.
Work.
Who wants to work like that? I can only.
Right.
So, like you said, you have to make, as every man for themselves, you have to make that decision.
Right.
Me stressing out mentally about it.
Like I said, I had to start taking medication. I tried not to, but it was getting bad, and it was affecting my mood. It was affecting my personality. And I had to check myself and say, okay, you need to take something.
That is not.
Yeah. Yeah. Mm-hmm.
I'm glad that you did that and that you went and got help and not just suffered, with that anxiety.
Oh,
like
no.
that. So.
Oh, no. I knew. I and my friends, I said, I knew. I mean, I'm sure, I was getting a little cranky and edgy, and that anxiety, and like I said, and then I would, in the morning, I don't want to say I couldn't open my eyes physically, but my mood was so that I would lay in bed for 30 or 40 minutes with my eyes closed, trying to just this wishing and praying. I'm like, just please tell me this was all a dream. Like, I literally would just lay there, like, it's so hard to explain. I just would lay there like, oh, like, is this my reality again today? Like, seriously. It was awful. Like I said, I had to just, and I don't have a problem with saying that, I had to just get on some medication, because I'm like, I can't, it was getting worse. Every day it was just getting worse. My anxiety was just awful. And then to go to the Red Cross blood bank, and when the man said, like, you all's blood is, I'm like, oh, Jesus, like, where's a Xanax? Like, what, like, like, oh my goodness. But yeah. You recover physically, but you also have to emotionally and mentally recover. Yeah. And
thank you for sharing that with us.
Absolutely. Yeah, I've had certain people say to me, like, Sabrina, I don't know if I could have done that. I don't know if, and I say, well, everybody's different. I don't know. Everybody's different. I want to tell my story, and it's just mine. Everybody has to do what's best for them, like I said. But I just want you all to know, and for the ones that's going back to work, please be careful, because it's just not, COVID is physical, but it's emotional, and it's also mental. It's also emotional and mental. It is.
I can see that.
Woo, child.
Yeah.
That's a lot.
Yeah.
Thank you so much for sharing. I don't know if I could have done it. I would be milking it. I would be like, oh, I can't do nothing. Paint my toenails. Come.
Right.
Like,
yeah. I mean, I don't want to, I don't want to come off like, make it really sad and depressing, but yeah, you ain't got to milk it. It's real, Martell. Let me tell you, it is. It's real. Do you hear me? Yeah, it's real over here. Like, to the point where I'm like, okay, Sabrina, you got to pull yourself together. You got to get yourself together. Like, I felt myself going down.
Wow.
And I said, I'm like, you got to, come on, you got to pull this together. Seriously.
That's good. You were strong enough to do that, because some people would just lay there and just tap out.
I know. Oh, absolutely. Absolutely. I mean, I'm like, wait a minute, how many days has it been since I took a shower? Okay. And the fact that you can't taste, or the fact that you can't smell, I mean, I'm joking. No, I'm serious. I mean, it was a meme out, and, I told my best friend, I said, not being able to smell, I'm like, I ain't took a shower in 3 or 4 days. I'm like, okay, I think I need to take a shower.
Right.
So, I'm like, You know, so I mean, but that's the reality of it. Like, you know, I was like, okay, Sabrina, pull yourself together. Yeah, you looking crazy.
Right.
Yeah. So, but thank you all for having me again.
You're very welcome. Thank you for sharing.
Thank you.
No problem. No problem.
It's always good to see you. You look great. So
Thanks. Thank you. Like,
girl, that's a lot. I'm just like,
it is.
But I'm glad we have an update. I'm glad you're well, you're better. For sure.
All right.
All righty.
Thank you, ladies.
You're welcome.
Please be safe. Please be safe and do what's best for you and your families, you know?
Yes, ma'am.
Yeah. Those jobs will be there.
Exactly. They sure will.
Right.
They'll be there. Okay.
Bye.
Bye.